Alzheimer's disease is a progressive and devastating neurological disorder that primarily affects the brain, leading to a decline in cognitive function, memory loss, and eventually, the inability to perform everyday tasks. Named after the German physician Alois Alzheimer, who first described the condition in 1906, it is the most common cause of dementia, accounting for 60 to 70% of all cases. The hallmark feature of Alzheimer's disease is the accumulation of abnormal protein deposits in the brain. Two types of proteins play a central role: beta-amyloid plaques and tau tangles. Beta-amyloid plaques build up in the spaces between nerve cells, disrupting cell communication and triggering inflammation. Tau tangles, on the other hand, accumulate inside nerve cells, causing them to become tangled and dysfunctional. These protein abnormalities result in the death of brain cells and the progressive shrinkage of brain tissue. The exact cause of Alzheimer's disease remains unclear, but it likely involves a complex interplay of genetic, environmental, and lifestyle factors. Certain genetic mutations, such as those in the PSEN1 and PSEN2 genes, are associated with a higher risk of developing the disease. However, most cases are believed to be influenced by a combination of genetic susceptibility and environmental factors. The clinical progression of Alzheimer's disease typically follows a predictable pattern. It often begins with subtle memory problems, such as difficulty recalling recent events or names of familiar people. As the disease advances, individuals may struggle with more complex cognitive tasks, such as problem solving, decision making, and language comprehension. Personality changes and mood swings are common, and individuals may become disoriented, anxious, or depressed. In the later stages, basic motor skills and self-care abilities deteriorate, leaving individuals entirely dependent on caregivers for even simple tasks. Diagnosis of Alzheimer's disease requires a comprehensive evaluation, including cognitive assessments, medical history, brain imaging, such as MRI or PET scans, and blood tests to rule out other possible causes of cognitive impairment. Early diagnosis is crucial, as it allows for appropriate management and planning for the future. While there is currently no cure for Alzheimer's disease, various treatment approaches aim to alleviate symptoms and slow the progression of the disease. Medications like cholinesterase inhibitors, e.g., donepezil and memantine, can temporarily improve cognitive function and manage behavioral symptoms. Non-pharmacological interventions, including cognitive stimulation therapy, physical exercise, and social engagement, can also provide benefits. Caring for individuals with Alzheimer's disease is often challenging and emotionally taxing, placing a significant burden on family caregivers. Support networks, respite care, and professional assistance are essential to help caregivers manage their responsibilities and maintain their own well-being. In conclusion, Alzheimer's disease is a devastating neurological disorder characterized by the accumulation of abnormal proteins in the brain, leading to a progressive decline in cognitive function and memory. While its exact cause remains elusive, ongoing research aims to better understand and ultimately find a cure for this debilitating condition. Early diagnosis and comprehensive care are essential for individuals with Alzheimer's disease and their caregivers as they navigate the challenges posed by this condition.